My name is Reggie Payne. I'm with the West Potomac Academy, and today I'm going to be showing goniometry of elbow flexion and extension and wrist flexion and extension. So first thing I would do is wash my hands, which I've done already off camera, greet the patient, hello, my name is Dr. Reggie, and explain the procedure that we're going to be doing today. So I'm going to be doing goniometry of elbow flexion and extension and wrist flexion and extension. Now, first part, I'm going to start with elbow flexion and extension. I'm going to palpate the bony landmarks, acromion process, lateral epicondyle, and radiostylar process. The acromion process would be here, right there. Lateral epicondyle would be right here, and the radiostylar process would be right here. So now I'm going to ask the patient to bend their elbow into flexion. So it should look like this. And I'm going to align the stationary arm with the acromion, and the axis with the lateral epicondyle, and the radiostyloid with the movable arm, which is here. So the patient had 140 degrees of elbow flexion, and the normal is about 150, so our patient is a little bit under normal. And then I would record the data on the clipboard. So now I'm going to ask the patient to bend their elbow into extension, repalpate the bony landmarks, acromion process, lateral epicondyle, and the radiostylar process, and realign the goniometry. So the patient had about 5 degrees elbow extension, and the normal would be 0, so the patient is about normal, a little bit under. I will record it on the paper. So next I'm going to be doing wrist flexion and extension, and I'm going to palpate the bony landmarks along the ulna, the ulnar styloid process, and the 5th metacarpal. I'm going to ask the patient to lay their arm on the table with the wrist hanging off the edge, and bend their wrist into flexion, which looks like this. I'm going to line up the stationary arm along the ulna, the axis with the ulnar styloid process, and the movable arm with the 5th metacarpal. Alright, so the patient had 70 degrees wrist flexion, which is normal, 70 degrees. I'm gonna there. So now I'm going to ask the patient to bend their wrist into extension and realign the goniometer. Stationary arm with the ulna, axis with the ulnar styloid process, and movable arm with the 5th metacarpal. So the patient had 42 degrees wrist extension, which is kind of under normal. Normal would be about 80, but he did have an injury on this arm, so that is expected. Log it there. And now I'm done with the goniometry.